Hacking Health live show. So I'm super excited. I've been actually setting this up in the background for quite a long time. And so we are live now. And I feel very lucky that I have a very, very good friend of mine here as my first guest. Bastian, welcome.
Yeah.
How are you doing?
I'm fine, thanks.
Yeah.
Thanks for having me.
So Bastian Hoelscher is an MD from Gevelsberg in Germany, and he's a functional medicine doctor. He's currently in the process of setting up a virtual practice system. He's working together with a functional medicine trained health coach, and he's very, very passionate about diabetes type 2 treatment. So in this episode today, we will talk about Bastian's personal journey around this topic of diabetes type 2 treatment, how he had to work with it in his own family, how he experienced it, how it's being treated in the German healthcare system, what challenges the current German healthcare system has in terms of the disease management program that is out there. We will talk about this. And he will talk about some of his mentors and some of the resources that he discovered as a doctor in diving into the world of functional medicine. And of course, he will just share with you all his results, what he really thinks about the topic. And without further ado, let's get into it. Bastian, tell me more about why you actually became a doctor.
Oh my gosh, this goes way back. Well, actually, that's a good story. I knew about wanting to be a doctor quite early on. And then there was like a phase in my life where I thought, okay, I managed to finish, my high school, and this was enough learning for me. So I got into a phase where I wanted to go into guitar playing and things like this. And then I kind of resurfaced because I thought, okay, just going the lazy way, isn't it? And yeah, it was clear quite from a young age that I wanted to become a doctor. But it's, yeah.
Were you surrounded by medicine in your life in some way?
No, I haven't. Not really. A lot of friends of my mother were MDs, right? And looking back at it right now, we were talking about like personal affection or affliction by diseases and diabetes. My younger sister, she has a type 1 diabetes, right? So this, of course, made quite an early impact.
Right. So you experienced how she had to deal with this while she was a child.
Yeah, exactly.
Yeah. So you saw the routines, the challenges. So what were the types of challenges your sister went through? What did you witness there?
Yeah, the basic points are, of course, all the food thing getting problematic, right? From eating whatever you want, going into, okay, come on, I really have to watch out. What can I eat? What can't I eat? And then for a type 1 diabetic, it's a totally different ballgame because it's really about measuring what you eat and looking into how much insulin you can take or your body can take, actually depending on your routines, how much you move the body and all this. This is really complex, and for a 13-year-old girl, that's quite heavy, right? And the whole family, of course, is impacted because you have to watch out for her. She can go into too low blood sugar states, and that's dangerous and all this. It changed a lot.
So you grew up with taking care of diabetics.
Yeah, actually, yes, I did.
Yes.
I never really looked at it that way, but
yes.
Yeah, of course, I did.
Yeah.
So my younger sister, I had to take care of her.
Very interesting. Yeah. So I'm trying to get the story out. So because it's always so incredibly fascinating why people get into medicine and healing, because it's such a unique job to stick with it, to really help people when they suffer. It's not like that you go out and you have a party and you have a great time. No, but you're actually dealing with people who really need help and who suffer. And so I think it's a very unique type of person who gets into it. And this is what I see in the functional medicine sphere, that they're all these doctors and health coaches, they're so incredibly fascinating. They all have so interesting stories. So tell me a bit, when you were studying at university, what was the type of knowledge base and that was being delivered to you there? what is possible with type 2 diabetes. What is the message you get at university?
Yeah, I mean, university is quite some time back already, right? But I mean, what I found or find more disturbing is that the knowledge that is till now given out to patients and I mean transported. I mean, I just lately, I mean, I had been running a normal GP practice, normal GP clinic. I mean, with state insurance billing and all this, and I went to holidays, so somebody else were taking over for me, and the patient of mine, he got diagnosed with type 2 diabetes, and the colleague of mine really sent him to a diabetologist, and not he himself, but some team member made like I mean had him talk into a nutrition what he should eat as a diabetic, right? And then he came back with this pyramid about nutrition, and there were all these different aspects in it, and he was like, yeah, okay, I mean, I should eat whole grains, and it was all circled in, and he was happy. Yeah, I can have whole grains, I mean, not all this processed stuff. And I was really like shaking my head like this. And I mean, this is 2 years back, and he was as a specialist for a diabetologist. I mean, I mean, I don't get this word right. And this was so frustrating. And I mean, the problem is nothing really changed, right? I mean, they told my sister back then, oh, come on, 20 years, 25 years, you can have everything you want. You just have to give enough insulin, right? I mean, they tell the people, and this is really a problem. They tell the people, you can eat whatever you want, right? You have to take enough insulin, or, okay, they tell them cut down on sugar.
So
right?
the standard measurement, the standard process here is you can eat whatever you want, but just take insulin for type 2 diabetics.
No, but this is mainly for type 1 diabetics. Okay. This is a kind of how they try to, I think, appease them to the idea that, or get them more comfortable with the disease, right? I mean, you have a heavy disease, it's very dangerous, you can die from it, but the good story is, the good part of it is we can already treat it, right? So, and you don't have to change anything. I mean, this is actually what is really implemented in an MD's mind in the conventional university setting, is that you have a disease. I mean, the patient comes with the disease, and your job is
to manage it,
to resolve it, without the patient having to do so much, right? I mean, this is the basic concept behind it all, and yeah, and this didn't change really, as far as I can see. Yeah, this would be.
And when did you go into practice?
I mean, I finished med school in 2007. Then I have been practicing, and I mean, I've been working in different hospitals. But hospitals, this is also a big problem, and this also explains very, very well why this epidemic of chronic disease cannot be tackled by the way normal MDs are brought up in the system, because you are brought up in an acute situation management of diseases, right? I mean, I see a diabetic in a clinic only when he's really low on sugar or has a high glycemic shock, right? So you never ever treat this chronic diseases. You always see like the end stage of it or the complications, and you are maximally trained into being able to spot these complications and to spot these very dangerous outcomes of the disease, but you're never really trained in managing this chronic disease and really getting people better, right? Yes. I mean, that's not what you trained in.
So when did functional medicine appear on your radar, Bastian?
This is a bit funny story, because I, from the get-go, from starting my Western medical studies, I was simultaneously started Chinese medicine, right? And I treated myself. I mean, I was treated in the beginning by practitioners, and I treated myself in the end with Chinese medicine mainly. And at some point, my big idol, Dr. Yaron Seidman, he went into creating an online educational tool, and he wanted me to deliver the Western medical part of it. And by then already, I was like, come on, I wasn't really interested in it because I was doing Western medicine to kind of, to save a living, right? To make a living, but not out of passion. I was doing Chinese medicine back then mainly, right? And then I said, no, I'm not interested. I don't want to talk about Western medicine at all. And then he said, okay, check out, is there something new? And I said, I don't know. And then I actually contacted you, Matt, back then. And I said, yeah, you talk about functional medicine. What is it? And you,
Really?
yeah, really, this was you. And
Oh
then you
my
gave me
God.
some literature to study, and I got into the books of Dr. Perlmutter. And
Yes.
I mean, the funny thing is that my main problem was like irritable bowel syndrome, right? I mean, I
Mhm.
always had problems with my gut, and I got it quite well with Chinese herbs, right? And then I read this book from Dr. Perlmutter, and I was like shocked, right? And I said, okay, I mean, I have to try this. And then I went for the paleo diet, gluten-free, all this, and my gut really got healed, right? I mean, before it was like, okay, I would eat some junk, whatever. Back then I thought it was healthy. I got my gut issues. I took some herbs, and that's got better. And I was quite happy about it. And then
So
I
the
really changed
first,
my diet, and the problems were really
mm,
gone, right? And this
so the
was, I mean,
first
shocking.
physician that showed up on your radar was actually Perlmutter.
Yeah, this is the first book I read. I think it was this Brain Maker is, it's his second book. Yeah,
Mm. So and then you followed his protocols, you implemented them in your own life.
exactly.
And what other doctors are inspiring you in your practice of medicine?
I mean, coming back to diabetes, the second book then I read was like the blood sugar solution from Ironman. I mean, this really shocked me because I mean, this was the first time I was exposed to the idea that insulin is a problem and not the solution, right? Because in Western medicine, you are trained that, well, you have this horrible disease and I mean, there's nothing you can do about it, but the good news is we have insulin, right? And he was the first one to introduce me to the thought that more insulin is not the solution, but part of the problem, right? And that, I mean, conventional medicine doesn't even really care to get down the load of insulin patients, I mean, have to take or are exposed to, I mean, either by themselves, by eating so high glycemic foods, or by giving it to them, right? So, yeah, I mean, Mark Hyman had been part of it, and Rangan Chatterjee. I mean, this is, for me, my real personal hero. I mean, he is so, because, I mean, what I like most is his lifestyle changes, right? Because I have been working in a clinic with bill state insurance, right? And I mean, within the city I worked in, I mean, these are steel workers. I mean, they're really down to earth and they don't spend money on medicine. Come on, what is this? I mean, they pay state insurance and that should cover it. So the only thing I could do anyway, I mean, I couldn't sell them anything. So I had to really give them lifestyle advice, right? And some were open and some were rolling their eyes when I talked about nutrition again, right?
Amazing. So we see how the socioeconomic limitations, they were affecting their health and their access to specific type of medical care. But because the lifestyle-based treatment approach is as well so affordable, it was actually matching their socioeconomic challenges.
Yeah, but the problem is, and this was frustrating you when we talked about it before. You said, okay, what were the toughest? What's the tough patient? What made it difficult for you? The problem is that I mean, I could never really talk them into nutrition on the time base I had in the state insurance model, right? So I would do it anyway and go overtime all the time. But people really need somebody to take them at the on the hand, right, and walk with them through it. And I was talking about nutrition, and I was handing them out all this self-written stuff, what they should eat and shouldn't. And I mean, of course, there were some who just tried it and were amazed how well it works. But there are so many who just couldn't do it, didn't see the sense in it, the meaning in it. And for this you really need more time, and this isn't in the modern in the system we are in right now. There is no time. I mean, if you spend 10 minutes with the patient, 15 minutes, you're already, I mean, really
Yes.
generous, right?
Yes. So there's a new model, Bastian. Tell us all about it.
Yeah, I mean, right now, I mean, after 5 years working in this style, I mean, I gave back my state insurance. I mean, my ability to build state insurance, and I went to a private clinic, right? And this is, I mean, we are back at the same problem that people have to pay for this kind of medicine, right? Because state insurance practices can't, I mean, just don't deliver it. And I mean, all those diabetologists who are out there, they do hire nutritionists, but they really stick to the old model that you can have carbs, you can have all this, you have to just check your insulin, how much you give, right? Or you have to, I mean, you have, I mean, yeah, I mean, basically they stick to this paradigm that carbohydrates, I mean, you shouldn't have too much of them, but the problem is they don't really give good advice how to reduce them. This was, I mean, this was funny when I was thinking about it earlier this day, that actually what I tell my patients now in this functional medicine setting isn't so much different from what conventional doctors tell them. I mean, eat less sugar, move yourself more. I mean, this is all, I mean, everybody knows about it, but how do you break it down so a patient can really take it, right? And well, I mean, I have some really touching story, because I had like an 83-year-old lady, right? And she had been, I mean, a diabetic for all her life, very astronomic high blood pressure, nobody could tackle. And she was on metformin, right? And this drug can easily interfere with kidney function. So at some point of her journey, we had to take out the metformin because her kidneys crushed. And so this was the moment she needed insulin, and I wasn't so versed with the insulin, so I sent her away to a diabetologist, and he put her on insulin. And she was
a question. A question for you. Do you know about David Sinclair?
No, I didn't hear. I didn't.
So he did extensive longevity research.
Okay.
And he looked a lot into as well metformin and blood sugar issues. So that would be very interesting for you to check out, and I would love to hear your thoughts on this.
Yeah, I know it is good for longevity. I know about this. I mean, with her, it was just controlling blood sugar, right? And I mean, what I want, the point I want to stress is that she really couldn't stay on the metformin due to her kidneys. So she was set on insulin, and she really got so sick on the insulin, she really couldn't take it. And she was, I mean, quite simple. I mean, I didn't think she could manage to get off the insulin all by herself, but she managed with the help of her daughter really to get off the insulin, or to really reduce it by changing her diet. And then her blood pressure really also dropped, and a lot of her symptoms got down. I mean, became really much better just by changing her diet. And this was really beautifully. I mean, I really took the time, and I said, come on, I won't charge you. And then her daughter kicked in and searched the internet for all these low carb recipes. This was really beautiful, right? But this you can not do on a regular basis, right? So, and then, yeah, and then people have to pay. And this is why I'm now teaming up with a health coach, because I mean, when they pay me for all these little steps, it gets very expensive, right? And this is where I think a health coach can be really helpful, right?
Yes. And you even thinking of a virtual model?
Yeah, I mean, this is what I would like to go, to be a bit more independent, to be able to travel also a bit more. And yeah, this would be great.
Going to the US, meet some fascinating doctors there.
Yeah, why not? Why not go there? Absolutely.
Okay, so let's get into some very practical steps for people. So if they never heard anything about functional medicine treatment for type 2 diabetes, what are the top 3 lifestyle interventions that you could recommend to us?
Yeah, I mean, first of all, I think what is so, I mean, this is funny because I come from Chinese medicine, and in Chinese medicine, you also try to be very individualized, right? And so this is in functional medicine too. So there is actually, I mean, I will point out 3 important steps, but it's not so easy to say, okay, this is for everybody, right? I mean, you really try to look at the thing, at the person in front of you. But of course, I mean, in our environment, what really is the biggest factor is probably like this very high glycemic processed foods that everybody has, right? I mean, coming back to these recommendations that people get from their normal doctors, it's eat less sugar, and they say, sure, I cut out the sugar from my coffee, and they're very happy, right? But then they have a roll for breakfast, and then they have potatoes for lunch, and then they have pasta for dinner, and this is of course all sugar, right? But nobody really tells them. I mean, really, they don't know that all this is sugar for the body, and even can be higher glycemic, it can be a higher glycemic index than potatoes are, right? And then sugar itself is. So, I mean, it is really breaking it down to them. I mean, I had one patient, this was really funny, like this week even, struggling with type 2 diabetes, and it was clear he couldn't get the message. He really would not be able to. I mean, I made like 1 hour nutrition with him. I talked about all the nutrition in length, 1 hour, and he couldn't get it. And then I sat down and I wrote him 3 alternatives for breakfast. And I said, you go back home, you come back in 2 weeks, and those are the 3 things you have for breakfast. Some yogurt with nuts, yeah, some special paleo bread.
Did it work?
And an omelette. I will see. I will tell you later, right? I will tell you in 2 weeks, right?
So how do you know, when we always talk that in functional medicine, we are charting out a journey for the patient. How do you do that? Because you have to take them by the hand. You have to be their advocate. This is what James Meskel very beautifully talked about at the Functional Forum in Netherlands. I was participating a few days ago. And he explained, okay, look, guys, first it was the technology enabled the fast education of the doctors of the community and spreading the knowledge and letting the public know about it. That was the evolution of medicine, his first book. Then came out the community cure, where he then talked about coaching practices and community programs and getting people involved back into community. And then he said, Matt, but now the new thing, well, that's the current book he's writing on, is about patient advocacy. That he thinks that patients really need someone who has lived through it, who knows it inside out, like you do with your sister, with your experience with your sister. And because of that, there's that innate empathy and compassion there and kindness there that is I think, very much lacking in our standard Western medical model, where it's actually encouraged to be detached.
Yeah, and this is, I mean, this is a big, if you ask me what is the journey, what is it all about? What is it all about, the functional medicine model? I mean, it is lifestyle change, because I mean, the impact you can have on your body, if you change your diet, if you change your sleeping behavior, if you change your stress level, if you change your movement, is so much bigger. I mean, you shouldn't need to explain this to anybody. It's so much bigger than any drug can have. I mean, they just go on with their everyday life that brought them to the very situation they are in, taking metformin. I mean, that's not it. I mean, that's really, yeah, I don't want to say this word. And I mean, the self-coaching is great. I think a little bit because, I mean, right now I'm still in the doctor mode, and it's a bit bad cop, good cop, right? I mean, I tell them what to eat and what not to eat. And the health coach is understanding that they can't do it, right? And gives them little steps. So I try to deliver like
you
the
want
big
to reverse
picture.
that dynamic.
Yeah, that's outsourcing some of it, right? No, but it's really good. I really like it because so I give them like really the solid foundations, and I think my MD told me to is not a bad thing to start, right? And if then the health coach talks in the same line, I mean, this is really great, because usually the MD sends them to a nutritionist and she says something else, and the other one, I mean, I don't know, the hairdresser has another idea, so they're really confused. So you need
it's
people.
the alignment of the same values and
Absolutely.
the same operating system.
Yeah, and listening and being exposed to the same information from different angles. I mean, this really is very important, right?
Fantastic. So yeah, tell us a little bit more about how we can manage stress better.
Let's go back, because you said the 3 things. Okay, let me stick to this. Let me finish this first, right? I mean, so the first thing, and this is what I like most. I mean, this is what I tell every patient, is how Rangan Chatterjee put it, like, unprocess your diet, right? I mean, this is, I mean, if you can basically more or less eat all the stuff you eat right now, but let them be unprocessed, right? I mean, process them only by yourself and not by high energy machines, right? I mean, just take them in your hand and cook with them yourself. You're gonna lower your glycemic index considerably, right? And then, I mean, low glycemic indexed foods, of course, like paleo-ish diet with a lot of vegetables, like, I mean, high fiber intake, right? High fiber content of your foods. This would be number 2. I mean, not only low glycemic, but high fiber to really change your gut flora. And number 3, well, actually it's exercise. I mean, you can really do so, I mean, so easy little things that make your muscles welcome in sugar without needing insulin to get it in, right? I mean, the moment you exercise, all your muscles open up the doors for sugar without you needing insulin. So you go down from insulin resistance. I mean, those would be the 3, I mean, basic things. And then you talk about stress, and of course, this is a big topic too, right?
But I know you have been experimenting with red light, for example.
What do you mean about it?
Can you talk about red light a little bit? Is that any useful in terms of regulating sleep rhythms when people are, you know, very stressed or their cortisol levels are deregulated?
Yeah, I mean, this would be, I mean, okay, so we have like low glycemic foods, we have high fiber diet, we have exercise, and then of course stress is like I mean, and this is why I would say I mean, functional medicine is really individualized, right? Because not everybody has the same topic. I mean, for example, which is very interesting, I have one cancer patient who is on a ketogenic diet already for 1 year, and he has still high HbA1c, so he has still high blood sugars. And I was wondering how this could be, but he is so stressed. I mean, he is self-employed. He's really putting himself under so much stress to stick to this diet. So he's so stressed, so his cortisol levels are so high. And cortisol is like a glucocorticoid, right? I mean, this is gluco from glucose. So it is there to enable your body to have high glucose levels, so you be able to run away from the tiger, right? So stress management, of course, without it, it's impossible. And their sleep is, of course, crucial. And this, I mean, this red light is missing in our lives because we are exposed to all these artificial lights at night. So what I wear, I mean, you have some glasses like this. I got a cheaper one from Amazon, right? And this is like more like this, goes over the whole head. So I try to put it on as often as I can, even if I have to use technology at night. So my melatonin goes up. So I go to deeper sleep easier, right? Yeah. And this, of course, is essential for sleep, for stress management, right?
What functions does melatonin have in your body, Sebastian?
Well, a lot. I mean, first of all, it brings you into deep sleep, and then it's a very potent antioxidant, right? So, and high blood sugars, of course, are also inducing oxidative stress. So this is this would be very important. And of course, I mean, this is quite interesting. The stressed you are, the more you tend to go down like your usual routes, right? And to change behavior while you're stressed is very difficult. And changing this diet can be really stressful also, and can be really, so people will fall back on their usual way of living and eating when they are stressed. So, I mean, it's crucial.
Have you heard about, it's a very nice model from, I think, Mihai Csikszentmihalyi in the book Flow. And he talks about unconscious incompetence to conscious incompetence to conscious competence to unconscious competence. And these are like it's like a path of changing, learning a new skill or changing a behavior. And often in the step between the first two, this is the biggest challenge when you go from unconscious incompetence to going like, oh shit, like I have a serious autoimmune disease, I got to change my diet. This can be very stressful.
Yeah, and this can really take a while. I mean, honestly, I mean, all this stress, I mean, how big the impact of stress is on every disease. I mean, I'm struggling with it myself, right? I mean, it's not, I mean, it's, I mean, really to make these changes, I think this, how is he called? There's this essentialism in this book. He has it like, I mean, make one decision that makes 1,000 decisions, like, I mean, obsolete, right? So if you decide not to eat gluten, I mean, you don't have to think over it again and again. Will I have this cake or that cake? No, I don't eat gluten. Yes, period.
Is it
right?
nice, actually? Isn't it?
Yeah, I mean, I have to look it up how he says it, but yeah, make one decision that makes 1,000 other decisions not necessary, right? I mean, you make like strategic decisions in the beginning.
Yeah, yeah. And tell us, how has been that experience for you as a physician to practice that type of medicine?
Hmm. Well, it really puts you in another spot. It really puts you in another position, right? And this is why I started working with a health coach, because there are a few, and this is only few people that will take the information you give them, embrace them, and really go for it, right? And so I'm right now changing. So I'm working with a health coach, and also I'm doing my scheduling differently, right? I make shorter sessions. I mean, like I do one session for nutrition maybe, and then I let them come back like for half an hour, 2 weeks down the road, and ask, okay, how is it going? I mean, how is it with nutrition? I really stick to it. I mean, you are really also, my role is more a coaching role already. So, I mean, it really changes, because you cannot in this system be like the MD who tells the patient what to do. And if he doesn't do it, I mean, get lost, right? I mean, you can do it, right? But that's not helping them. So it's really, I mean, it really changes the relationship.
There's a huge educational piece to it.
Absolutely.
And I can see, like, for example, how great Dr. Mark Hyman, it's so beautiful when I see him on Instagram popping up on my feed, and then he just, cooks a great meal and shares a meal with the community. I love that.
Yeah, absolutely.
And I think that he's really embodying that hero physician, that mentor physician who is living it, and he shows it to the community. And I think this is the amazing thing, what we can do with technology. We can inspire and lead through our example without us being there.
Yeah, and this makes it also different, because this makes the difference from the traditional MD that you, I mean, you will not be able to convince people to do something you can't do yourself, right? So, I mean, I'm a big advocate of bone broth, right? I mean, for gut healing, and it's a better coffee anyway, right? And this is a funny thing, I've been doing this because I come from the Chinese medicine. Basically, I've been doing this for 20 years. And if people tell me, oh, it's so hard to do it, I mean, I get my organic veggies in the pot in 20 minutes, right? And then I just let it simmer there.
We have to talk about this. I think the first educational piece that you will bring out into the community is a really nice little bit of an online workshop about making your perfect bone broth.
Yeah, absolutely. Yeah, it makes such a big difference. I mean, I've been working night shifts, right? And without the broth, I would have died.
Right. Okay, we actually have a few questions from Caroline here. She posted one. Should we open it up now for like a Q&A, Bastian?
Yeah, sure. Why not?
That would be nice, I think. Guys, join in.
I just had one question specifically about exercise, which was, is there any type of exercise which is better in terms of creating that kind of opening up the gate of the cells for sugar, or is it just any kind of exercise?
Well, as far as I'm into it, I mean, it's mainly, I mean, it wouldn't be like a cardiovascular workout, like running for 2 hours, and this is also not practical, right? I mean, there's something I show my patient, like, I don't know how you call it, this, if you sit with your back on the door and you just go in your knees,
yep.
There's a name for it, Matt. Do you know what the name it is?
Like resistance training?
Yeah, it is resistance training, but there's a name for this posture where you're like sitting like...
It's like a horse stance.
Yeah, exactly. And you can just...
A chair posture.
Chair posture, and you can put your back on the door and go down. I mean, this very old and disabled people also can do. And this really makes all the muscles in your leg really work hard. I mean, if you do this one minute before your meal, and already these muscles really have to work, right? And they will open up. So, I mean, this would be my...
You know, Tim Ferriss, who's like the king of the minimal effective dose. I mean, he writes in his book, The 4-Hour Body, the two exercises he really recommends the most is like the deadlift and the squat.
Yeah, this is a squat
because
actually.
they really
It's a squat, yeah.
activate.
It's
Yes,
a squat. That's the name
yeah,
for it.
because
Exactly.
they really activate like the big muscle groups.
Yeah, exactly.
And
And
then they will, the more muscle you activate, the more sugar you will pull in, right? So,
I mean, I do this from time to time here in my clinic. When I'm on the phone with the patient, I go to the door and I sit in this position. Yeah, I mean, come on. That's very easy.
it's interesting. Any other questions, Tammy? Tammy, tell us about you. What do you, because I haven't met you yet.
No, you haven't. Well, I am now coaching for about 7 years. I am Greek. I have lived in 10 different countries, and I have 3 kids, teenagers. And I've done a lot of things. I've studied a lot of different things. And I think due to my personal journey, I ended up at IIN. And from there, I mean, I literally fell in love. I tried everything. I went 1 week paleo, 1 week vegan. I did everything, fasting, everything. And I started changing, and people started watching that. And then they said, oh, what do you do to yourself? Can you do that to us as well? And that's how I started coaching. And I actually started coaching on the first month. I don't know, it was everywhere showing. And yeah, it's 2 years now. I'm into this functional medicine course, which I really, really enjoy. However, my heart and my asset is the simple stuff. Like, I work a lot with people and I explain them how to meal plan, how to store their greens, how to find 4 minutes to do. I'm running at the moment actually a plank challenge on my group, where I say to people, just no matter what, find 3 minutes and do a plank, or 2 minutes, or 1 minute.
And
it's
do
about
a plank, the plank challenge. Great.
Yeah.
It's about commitment, it's not about the plank. It's about committing that you can do it. It's about mindset. It's about everything. So there's a lot of people now actually starting to do it.
I love the Greek cooking culture. Oh my God. Remember, where we were, because I was in Athens when Yaron was there, when he was giving the Hunyan medicine workshop. And oh my God, how I loved the evenings, like spending 3 hours eating meals in a beautiful, warm Athens neighborhood.
Yeah, that's a Greek culture.
Greek food is such a fine cuisine.
Yeah.
So healthy as well. Tell me, Tammy, are you in Greece right now?
No, I'm in Holland.
Holland, yes.
Yeah.
So how's the health state of the population in Greece?
Oof, that's a difficult one. Look, basically we have what we call the Mediterranean diet. Though the Mediterranean we used to have, now there is a lot of McDonald's, there is a lot of shops where you can buy, sandwiches with all kinds of stuff. So the Greek culture has a lot of vegetables, quite a lot of protein as well, a lot of olive oil, a lot of fresh food. But at the moment, I don't think we are actually doing that well. Actually, Greece is the second country in children obesity, together with Italy and UK. So that says that the culture is not doing very well. There's a lot.
Are you speaking Greek? Of course.
Yeah, I speak Greek. I speak very good German because I studied in Aachen. I speak French and Italian. So I've been all over the world. So always I made a point to learn the language.
Amazing. Thank you so much
for
that introduction. Well, again, I see like it's just such an amazing community. So much intelligence, so much life experience, so much depth to so many different facets of life.
I had a question for Bastian, if I may.
Please.
I was really interested, Bastian, to hear your experience of working with patients and what you kind of were mentioning about your MD said, do this and you'll get better. And obviously, when it comes to food, it's a really funny one because it's a really difficult one to have to tell people that they have to change their food. And I don't understand what is the block and why are we being so almost walking on eggshell about this? Because even as a coach, it's very difficult to kind of say to people, look, stop eating crap, because quite frankly, this is, you know, let's call a cat a cat. That's what we're dealing with. People are eating crap.
I think sometimes you got to say it.
Well,
but with
today
humor. With humor.
Today I had a client and it was about stress rather than food, but I was like, right, I've had enough. It's been 11 sessions now. And I said to her, I said, you've got to stop going to bed at 2 a.m. Like, you know, normally we don't have to talk to clients like this, but this time I was like, I'm sorry, Alison, but I've got to say, you're not going to get better until you really get your act together. But, you know, it's hard. It's hard to get people to understand that what they put in their mouth.
I think this is why it's so important that it is a journey. It is a journey to become emotionally more mature, to change your habits, to find the inspiration when the chips are down. You know, I know it for myself with autoimmune disease, yes. But it really is a journey, and it needs inspiration and empathy and leadership.
Really. Well, and it needs a certain amount of suffering. I mean,
yes.
those are. I mean, the worst people. I mean, those people who will really look at me like with rolling eyes and like a deer in the headlights. I mean, those are the ones. I mean, I just had a couple here just before the session, and they came in from my prior clinic, where I was still. I'm Western Medical MD mainly. And they came in just for a checkup, right? And they said, okay, we really want to stay healthy, blah, blah, blah. What can you do for us? And I said, yeah, sure, I can do a lot for you, right? And I did all the lab panels and all this, and I started talking to them. And I mean, my point in nutrition, I mean, because this is my own route, is, I mean, I started all this crazy cutting out gluten journey. And because what Dr. Perlmutter said was so convincing for me that I have to start it, right? And and I had issues with my gut, but I mean, those people are perfectly healthy. I mean, sonolin was high, so I had some things to show them. But anyway, they believe they are quite healthy. And for them to change without a real reason, like autoimmune disease or pain or anything, is really hard, right? And I'm not sure I can convince them. I mean, they have to have an own motivation. Like, I have this problem and I want to get rid of it. Okay, this is what it takes. Shit, but I'm ready, right? But I mean, people who think they're healthy and they just want, like, I mean, it's very difficult. There has to be a certain amount of suffering. I mean, for all of us, right? Honestly.
Yeah.
So
well, I mean, I don't know your health journey, Bastian, but obviously I got sick. So, and that's what led me to change. But obviously, knowing what I know now, I know that for 5 years there were signs that when picked up.
I mean, I was on the brink to go into I mean, I was at the point that I thought I had like an eating disorder. Honestly, I was at the point where I thought I have an eating disorder because I had so many gut issues, and I'm an MD myself. I was sure, I mean, no colonoscopy will change this, right? I didn't even go there, right? And then I had like, and I was always thinking I had a eating disorder because I felt so I mean, so bloated and overfed. And then I had like two rolls with a bit of fish on it in the morning, and I felt like awful for 3 hours. And I said, okay, I mean, for a 180 guy, I mean, this is not too much food, right?
Yeah.
So then I was willing to change it, and then I was shocked how well I felt, right? I mean, the discrepancy from one state to the other was so big. I was like, wow.
Yeah.
So
I mean, I've just finished a program with a client, and he's been amazed in 8 weeks how his health turned around. 8 weeks.
Absolutely.
It's incredible how fast.
Yeah, absolutely. The body really can adjust.
So what's the time?
Tammy wanted to say something.
I just want to add something. May I?
Yeah, sure.
Yeah, of course.
You know, I don't know how to translate very good in English, but there is a saying in Greece, and that is called I'm going to try to translate the snootiness of the people that know. Meaning that when somebody knows a lot, he develops a little bit this, but why cannot you get it? And I think one of the issues that we have to be very careful is that we know much more than the normal person does. And that makes a big difference. We know, for example, if you get an autoimmune disease at 20, at 40, you might be sitting on a wheelchair. The normal people don't know that. They don't understand gut permeability. They don't understand antibodies. I had a client yesterday. I said, how is the health of your mom? She said, oh, she's great. She just had breast cancer. And but then, you know, I had to remember she doesn't understand cancer the way I do. So I think one of the things we need to keep in mind is that a lot of people don't really understand. Oh. And don't understand what we know, what we see. They don't see the black future. So I think we need to put that into an equation when people don't understand.
Yeah, absolutely.
Oh.
You were promoted to be the host, Tammy.
We've lost Matt.
Yeah, it looks like. Yeah, and I mean all this understanding that disease is a process. I mean, people still, and this is this is really so cruel, because I mean, all those how you call it, ongoing education for MDs, I mean, constant education, I mean, they all repeat the same stuff, all the same. You have a disease, it's called diabetes. This kind of insulin makes a better HbA1c, and that's it, right? And it's really that it's a progression. That's really a progression that's going that way, and that you can turn it back when you change behavior. This is just this is not heard of, right? So this is really, I mean, functional medicine for me, the biggest part is a paradigm shift, right? So you really shift from looking at this disease in a kind of, oh, I can't do anything about it, and it came over me, who knows why and how, into, okay, this is my body adapting to a really not healthy environment. I mean, this is the biggest, this is the biggest thing about functional medicine, right? And then you can put anything in, Chinese herbs, Western herbs, diet, lifestyle, all of it, right? I mean, but you know this.
Yeah, no, absolutely. I mean, it's fascinating, and you know, thankfully there are, you know, things are changing. You know, we've got MDs and nurses and pharmacists and, you know, loads of people at SAFM and the Institute of Functional Medicine, and, you know, it is changing. The other day I had my little cousin who's she's doing a PhD in pharmacy in France, and I was talking to her about the Krebs cycle. And she said, oh, I did that like 4 years ago. It's really complicated. I went, yeah, it's really complicated, especially for me. But I was showing her all the stuff I was doing. And it was really interesting because she was saying to me, she worked as a pharmacist in hospital. And she said the number of patients she was seeing with polypharmacy. And as a pharmacy student, she was really shocked. And we were having a really good conversation. And I said, but do you talk about it at university in your course? Do you talk about the challenge? She said, no, not talked about. Not, you know, and they learn that polypharmacy is an issue, but they don't talk about how do we resolve it.
Yeah, but you know, also I think I have to say there, when the whole paradigm has to change, when the normal doctor gets sent to Mallorca, in Greece, it happens very often, through a pharmaceutical company, because of the drugs, because of what they prescribe. I mean, this whole thing has to break. And when this breaks, then I think we will have more doctors that will not prescribe.
Yeah.
But at the moment, they take them everywhere. So.
No, but you honestly, you can't, no. I mean, this is from country to country different. In Germany, it's forbidden and all this, right? But even though I'm not being sent to Mallorca by any pharmacy company till now, I mean, please contact me. I mean, even though there's not real money to be made right now for an MD like me through working with pharmaceutical companies, I mean, as a normal MD, you have invested quite a lot. I mean, you have invested time, lifetime, money, energy, building a clinic that all stands on this model. And if you really want to change people's life, you cannot work in this model. It's not, I mean, and I really struggled 5 years to understand it, that when I get like 20 euros a month for a patient, I cannot spend half an hour with him. This is not, it does not work. Absolutely not, right? But not spending the time with him will not make him better. I mean, the top 3% who are really committed. So you give him a book and he does everything that's in the book, but this is really the minority, right? So
yeah,
it's a paradigm shift, really.
Yeah, exactly.
It is. I've been asking my clients because I want to kind of.
I have to go. I have to put the kids.
Yeah, we're gonna.
Tammy, we talk tomorrow 10 a.m. Is 10 a.m. okay? Tammy, 10 a.m.
Thanks.
Bye.
Tammy, I'll speak to you tomorrow afternoon.
Yes, I see you tomorrow.
Bye.
Bye. Bye.
Bye.